everyone, so I'm here to show you the Ohio CNA Skill for male peri-care with the adult brief change. First, you want to start with hand hygiene. You're going to rub your hands until dry. Next, you're going to knock and introduce yourself. You want to explain the procedure to the resident and provide privacy by closing the privacy curtain. Then you're going to gather your supplies. Your equipment should include bath blanket, adult brief, 6 washcloths, barrier, gloves, soap, and a wash basin filled with warm water. You want the temperature of the water to be 105 to 110 degrees. Hi, Mr. Smith. My name is Davine. I'll be your CNA today. I'm going to be providing peri-care. Let's go ahead and raise your bed up. I'm going to go to mid-thigh to waist, so it's appropriate working height. You need to lower the head of the bed for the resident. You want the bed to be in the supine position, so the bed will need to be completely flat. Mr. Smith, I'm going to take the call light here and place it to the side. I'm going to go ahead and lower this side rail. I've already raised the side rail on the opposite side. If you do not raise the side rail, you will need to ask the test observer to stand there. Now I'm going to apply my gloves. Take your bath blanket. You want to place this on top of your resident and open it up using this technique because you do not want to expose the resident at any time. Remember, you are not allowed to shake the linen. Doing okay, Mr. Smith? Next, I'm going to take the linen that is underneath this bath blanket and I'm going to fan fold that down towards the foot of the bed. Again, you are not allowed to expose your resident. I am now going to create what's called a window. What this means is that I will only be exposing the perineum. I need to remove the soiled brief. I'm going to take your corners here and fold them over. Tuck those under the resident. You're going to do the same thing with the other side. Now you can turn your resident for this part, or you can ask them to thrust up with their hips. I'm going to have Mr. Smith thrust up with his hips. Mr. Smith, we're going to go ahead and bend your legs. And we're going to have you thrust up so I can remove the soiled brief. On the count of 3. 1, 2, and 3. Perfect. I'm going to take this brief and I'm going to go ahead and discard it in the trash. I'm going to take a barrier and apply this under my resident. Mr. Smith, one more time, I'm going to need you to thrust up on the count of 3. 1, 2, 3. Okay, we're going to go ahead and put your legs down here for comfort. Again, only exposing the perineum. I'm going to rearrange my washcloths to where I have 3 here and 3 here. The first washcloth, you want to fold in half, and then you want to fold it in half again. And that's going to give you 4 loose corners. I'm going to put it in the water, wring it out, and I'm going to apply soap to each corner. I'm going to rub together to make a lather. Mr. Smith, I'm going to start cleaning your perineum. I'm going to hold the penis, and in a circular motion, I'm going to start at the tip and wipe away. And that is because you need to clean in the direction of clean to dirty. Second fold of the washcloth. Third fold of the washcloth. And the fourth fold will go underneath the penis, down the scrotum, all the way down to the rectum. Discard. The next washcloth will be for rinse. Wring it out, doing the same technique. Find your loose 4 corners. Mr. Smith, we're rinsing the perineum now. And see how I have my thumb? That is to separate the clean and dirty folds from each other. Remember, you cannot lift the washcloth at any time. If you do, you will need to find another spot on the washcloth to rinse or wash with. Now I'm going to pat dry the perineum. I'm going to have Mr. Smith turn to his side. Mr. Smith, I'm going to have you turn to your side so I can clean your rectum. You need to be careful with the resident's arm. I'm going to cross that over their chest. Put this arm into the stop sign position. Make sure that there is enough space for turning them. You do not want them to accidentally hit the side rail. So make sure there is enough space before you turn them. Mr. Smith, we're going to go ahead and turn you on the count of 3. Ready? 1, 2, and 3. I'm going to move the pillow just for a second here. Are you doing okay, Mr. Smith? Okay. Again, only exposing the rectum. Taking my first washcloth out of the 3, I'm going to apply soap to each corner, creating a lather. And you need to start at the base of the scrotum and wipe up the backside. Again, you are going in the direction of clean to dirty. And this is because the urethra is cleaner than the rectum. Almost done, Mr. Smith. Discard, rinse, find your 4 loose corners, starting again at the base of the scrotum, coming up the back side. Discard, pat dry. Mr. Smith, I'm drying you off. Discard. I'm going to go ahead and roll the barrier and tuck that underneath the resident's thigh. And I'm going to take the brief, open the brief up, fold the corners where the adhesive is, and that's so it does not get stuck to their skin. And you want to make sure you go ahead and line it up now while they are on their side. Mr. Smith, I'm going to have you roll back over now on the count of 3. 1, 2, 3. Come on back for me. Very good. I'm going to cover your legs back up. I am going to fasten each side of the brief. I'm going to discard of the barrier. I'm going to check and make sure that the brief is not too tight. Hand fold the blankets back up as I am removing the bath blanket. Here we go, Mr. Smith. I'm fixing Mr. Smith's gown. Taking the bath blanket and discarding that in the appropriate container. Mr. Smith, I'm going to put you back into a position of comfort. Lift your head a little bit. Bring your arm back down. Mr. Smith, are you comfortable like this? Okay. I'm going to raise back up the side rail. I'm going to raise the head of the bed back up to its original position. I'm going to lower the bed to its lowest position. I'm going to open back up the privacy curtain. Mr. Smith, here's your call light. I'm going to take my wash basin. I'm going to empty, rinse, and dry the basin, return it to storage, return the soap to storage, remove my gloves, discard of my gloves, and to finalize this skill, you will need to complete hand washing. My skill is complete.